Hi everybody, this is Dr. Rob Lindsay again with Thyroid Treatment Success Secret number 12, brain function. Brain function is extremely important in treating the thyroid, as I've mentioned previously in other secrets. The brain controls every bodily function, right? Your pituitary gland drives your thyroid gland, and it releases TSH. The part of your brain called the hypothalamus drives the pituitary. Our brain needs two things to survive: fuel and activation. Okay? Fuel is glucose and oxygen, which is why we use exercise with oxygen therapy in our office. We have addressed the glucose end of the equation earlier. Now let's address the importance of oxygen. As you age, your ability to utilize oxygen decreases by 1% per year each year after the age of 25. If you are 50 years old, you've lost 25% of your ability to utilize oxygen in your body. This is called oxidative phosphorylation, which is a big, fancy $3 term, meaning you're not using oxygen as well as you did when you were younger. Again, this is why we utilize exercise with oxygen therapy, or EWOT, in our office. Secondly, the neurotransmitter serotonin plays a major role in thyroid function. There's a place in your brain called the hypothalamus, and there's something called the paraventricular nucleus. I know these are big fancy words, but it's critical that you know these things if you're suffering with thyroid symptoms. Serotonin acts on the hypothalamus paraventricular nucleus in the central nervous system, and what it will do is make you have low thyroxine stimulating hormone, or low TSH. Taking thyroid hormones for these problems is not going to do anything for you. It will most likely make your symptoms worse. Don't get me wrong, I'm not saying to stop taking your medication. That's called practicing medicine without a license. I can't do that. But you need to be aware of what is happening to your body. I'm saying be aware of what's happening because once you start asking medical doctors why you're taking these medications, they're going to look at you like you're crazy. Like you've got a psychosomatic illness, which means to them that it's all in your head. And the only thing you need is an antidepressant. And that's what we hear over and over. The biggest influence on serotonin is blood sugar. That's why we addressed glucose in thyroid treatment success number 11. So, if you're hypoglycemic, insulin resistant, or diabetic, it is vitally important to you that you maintain your blood sugar levels within an optimal range of 85 to 99. This is why it's important to eat healthy. Don't skip meals. Quit eating junk food. Every time you eat junk food, you're literally eating away at your thyroid and making your problem worse. By consuming a poor, junk food-filled diet, you will increase your thyroid symptoms, feeling tired or sluggish. You'll have an inability to lose weight, cold hands, cold feet, insomnia. You'll gain weight easily. You'll have difficult, infrequent bowel movements. You're depressed. You have a lack of motivation, and morning headaches that wear off later on in the day. The outer third of your eyebrows are getting thin. Okay? Your skin, your scalp are dry. You've got mental sluggishness. You're nervous. You're emotional. And you have night sweats. You have all of these symptoms, and yet your labs are normal in the eyes of your medical doctor. Remember, those labs need to be within the optimal or functional range. Again, don't hesitate to call us if you think we can help you. I know we can. 952-949-0676. Stay tuned for the next Thyroid Success Secret.